Can you walk me through an example of how this would work and what kind of client might find you?
Sure. Yeah. You know, there's a lot of nutrition information out there, right? There's no shortage of people that want to teach nutrition. Okay. And so one of the patterns that I realized is that, you know, we want to be able to turn things into a science. And one of the things about nutrition that I have a point of view on, and I think this would be a great thing to talk about, is that nutrition turned into a big math problem for a lot of people. And I think that, especially for those in the sugar addiction and food addiction space, having boundaries around food was like the key to success, right? Having a quantifiable food plan has been very helpful to a lot of people. But there's also a lot of people who are led down the path to believe that nutrition was just a big math problem, right? When in
Yep.
fact, there's way more to nutrition than how many grams or how many ounces or how many calories. So if you look at a lot of the apps that are on the marketplace, they really are focused on calories. If you think about MyFitnessPal, macronutrients. And one of the things that I've learned from my clinical practice is that a math centric approach to nutrition could be very helpful for one person, but it could be very harmful to someone else.
Yeah.
So, depending, and it depends on their psychiatric profile, depending on someone's mental health, their degree of cognitive rigidity, there might need to be different approaches, right? And that's what gives birth to this idea of like there are multiple paths toward recovery. Even with sugar addiction or food addiction, there might be one person who really needs a weighed and measured food plan. But there might be a whole lot of other people that just need guiding principles and need some really basic, clear things to learn and understand so that their life doesn't become a big math problem or it creates impairment and distress. And so those are the kind of things that I'm really interested in figuring out, learning about someone's mental health. What if someone has done math centric pass fail nutrition for a long time and that hasn't worked for them? What other ways of messaging nutrition might be helpful to that person, right? And so this is where, the individual assessment comes in. There's a difference between someone who's been on 25 diets in the last 25 years versus the person who's never gone on a diet before, right? And so we want to learn about someone's dieting history. There's a difference between someone who weighs 150 pounds but has been weight stable in a range of 10 pounds versus someone that has weight cycled for their whole life, right? So there's a lot of nuance in the nutrition space that I think is being currently missed. And I think when we think about recovery, we need to dive into the nuance, right? Everyone's different. There isn't some single plan that's going to work for all people. We need to teach people to become empowered, to have some of their own individual agency. And I know people, especially in the sugar addiction, food addiction space, like the idea of having zero agency and turning that all over to someone else. And I respect that. There's some people that don't want to make food related decisions. They want someone else to give them a food plan, and that's what they're looking for. But then you get people that have done that and have found that like that wasn't sustainable over long periods of time. And now they want to try doing something a little bit more like curious and open-ended rather than predefined.
Sure.
And everyone's different. There's people that need rigidity and there's people that need fluidity. And we're not doing a good job assessing what's true for people. I think we live in the era where practitioners get their sort of brand of recovery and they have like a philosophy. Practitioners develop a philosophy. This is what I do. This is what works for me. So if you come to me, I'm going to give this to you. And I think
Right.
that's a beautiful thing because people have a gift and they want to share it with the world, but it doesn't actually do a good job in investigating what's going to be most helpful to the client or to the patient, right? So I think that food philosophies are great. I've moved through a lot of different ideas in my career, but in many ways, a food philosophy is more beneficial to the provider than it is to the client or patient, because then you can just sort of like stay in the lane that you've created for yourself. But in healthcare, we need to think about the patient. We
Yeah.
need to think about what's going to be best for the person. It would be like if a cancer doctor had one medication that she really loved because it's what her husband took, and she just really loves this one cancer medication, and everyone who came to her practice was like, no, this is what I stand by, this is what I love, this is the medication you should take. That would be considered malpractice,
Yeah.
right? But
Yes.
in the nutrition space, right, that's definitely something that seems to be normative behavior,
Yeah.
right? And so, Wise Mind Nutrition is about this possibility that, what if there are multiple lanes that have nuance and that intersect and diverge and converge with other things? And, what if people could become the experts on them with the help from an outside expert?